Hey everybody on Tumblr, this is Ariana and I am making this video for the postitforward hashtag. If you need to find me again on Tumblr, my username is MeowsYourAri. That's where you can find me. It's also the username for many of my other profiles such as Facebook and whatnot. So, I'm going to try my best to make this video short and sweet. But I am here to talk about mental health awareness. That's why I made the postitforward for mental health survivors. Why survivors? Because instead of mental health sufferers or something tacky like that, I figured what is more symbolic to who we are than a survivor, because it's not just because, you know, of the suicide rates and whatnot. I think it's more than that. I think it's because every day we have to go through something. So a little backstory about me. I have suffered from bipolar type 1 disorder for several years now. I was first diagnosed when I was 15. I was later diagnosed with many other things, but bipolar has made the most impact in my life because I feel that it changed everything. All the symptoms, all the medications. I felt like a guinea pig at one point, you know. I finally found certain medications that worked for me, but there's also, you know, the repercussion of the side effects. So that's what a lot of people don't understand. Mental illness is not just something that's invisible and you don't really see it often in somebody, depending on the person. It's actually an illness. It's like a sickness. Since my bipolar came out, you know, I can't really go back to the same old ways. And that's why I always sometimes come back to this point where I'm like, why can't I just be who I used to be? It just doesn't work like that, and it never can be like that. So unfortunately for me, you know, that's how life is. And enough about me and my problems, and because I wanted to make this video shorter. I have tons of advice for people with bipolar, any disorder, whether it be A to Z, head to toe. I have so much advice because I want people to feel better about themselves. First of all, don't hate yourself. Try your hardest not to hate yourself. If you dislike yourself, you're a step ahead of a lot of people who are suffering the same things you have. It's not worth it. Just try to say one good thing about yourself every day. It's so much better than saying, oh my god, I hate what I'm wearing, it doesn't work, I don't like my makeup today. Just say, well, at least this is nice. At least I did this. I did this. Something, anything. Like, at least my hair looks nice. And not just appearances. It could be a personality attribute. Like, at least I'm smart. At least, I mean, even if it means you have to go the extra length to, like, say you're better than someone, I don't even care. Like, it will work. It will build your confidence up. And that's what you need to do most importantly. Self-love. Secondly, medication and other things. If you don't want to take your medication because you're afraid of the side effects, don't just stop taking the medication. And also don't stop taking the medication because you feel like you're normal again, or stable, or whatever you want to call it. You're gonna go back to the same way you were before you started taking the meds. And if you didn't like that way, why would you stop taking them? It's a huge problem that some psychiatrists don't really make it clear to patients, and I feel like that should be clear, or at least made clear. If you don't like the relationship with your therapist or even your psychologist or nurse practitioner, depending on your insurance, just try to switch. Because if you're not going to be honest with your therapist because of your relationship, or if you feel that you can't really be open and get to know who the therapist is and how they can relate to you, or if you just don't like them and you feel like they're not helping you, please switch them. You don't know how many times that I've had like numerous therapists, and you know, some of them didn't help at all. I don't even think they wanted to try to help. But you know, medication management and therapy go hand in hand. You can't just go, especially if you're bipolar, and then the bipolar that you're suffering from is just going to go away. That's not how it works. So I think that that's important. Now, basic advice for anyone who is just going through a tough time. I'm not going to say just deal with it. I'm not going to say, you know, it will get better. For some, it just gets easier. For some, it gets harder. It just depends on how you handle it and how other circumstances comes to you. Like, if you feel that it will never get better, it probably won't get better at that time because of your perception. And reality is defined by perception. You have to be aware of your surroundings. You have to be aware about what you're feeling inside. And no matter what you do, like, do you want to write and post to the world about how you feel, then do it. If you want to write in a journal, then do it. If you're going through a hard time and it feels like nobody in the world can help you, to the point where you feel like you just don't want to live anymore, please ask someone for help. Tell someone. Do not keep it bottled up inside. And you don't worry if you've been hospitalized before and you're worried about that. Oh my God, if I tell someone, they're gonna hospitalize me. It's not always the case, unless if you're really at that point where you just don't want to live anymore. I mean, if you tell someone, oh, I've had suicidal thoughts and I don't really want to hurt myself, like I've never had really any thoughts recently about what I'm gonna do to kill myself, then that's totally different. Nobody will really see that as like a danger. Just be clear with them, you know? I mean, nobody wants to get hospitalized. I sure don't want to get hospitalized again, but it could happen, and I have to face reality, you know? I mean, it's tough. It's tough being me, and it's tough being you. But you get through it. Somehow, you have to. And that's why I made this video. That's why I felt I had to make a message to people who don't know how to get past pain, depression, anxiety. You could get through it. I know you can. So that's really all I have to say, and I hope that you can reblog or favorite or both this video. The hashtag is postitforward, and my image that I made, and it's also on my profile, is postitforward mental health survivors. And remember, the keyword is survivor. So keep on surviving, and hopefully I'll make more videos. I don't know. Alright, so thanks for watching. I know it was a long video after all. And yeah, okay. Ariana out. Bye.